Will lung transplant become a new option for select patients with advanced non-small cell lung cancer? Are insurance formulary denials increasing and delaying medical care? Do online prescriptions for GLP-1 medications have proper oversight? And what should clinicians keep in mind when caring for patients with alcohol-related liver disease? This and much more on today's JAMA Editor's Summary. Welcome to our listeners all around the world. Today is July 10th, 2026. I'm Dr. Linda Brubaker, JAMA Deputy Editor, sitting in for JAMA's Editor-in-Chief, Dr. Kirsten Bibbins-Domingo. Today, I'm joined by Dr. Preeti Malani, JAMA Deputy Editor. Preeti, let's get started with the research article that explores a novel clinical approach for patients with advanced lung cancer.
Sure. Thanks, Linda. Lung cancer remains a leading cause of cancer-related death worldwide. And the classic teaching has been that lung transplantation is not an option for patients with advanced stage 4 non-small cell lung cancer, even when the cancer is confined only to the lungs. This has largely been based on data from earlier studies, but these studies predated modern cancer therapies, current staging standards, and also used surgical techniques that could have promoted cancer spread. In a prospective single-center registry study, Dr. Barath and colleagues followed 17 patients with advanced non-small cell lung cancer who underwent bilateral lung transplantation using a dissemination minimizing surgical technique. That means using certain techniques like early pulmonary vein control and extensive irrigation to limit spread of tumor cells during surgery. Compared with 81 otherwise eligible patients who received non-surgical medical management, those who underwent transplantation saw a significant difference. 1-year survival was 100%, versus just 41% in the medical management group. The surgical group's early post-transplant survival was also non-inferior to that of 306 patients without cancer who received lung transplants. So for this very select patient group, lung transplantation was associated with longer early survival. While broader application will need much more data, both in terms of longer-term follow-up and quality of life assessments, this approach may eventually offer a new treatment option to a group of patients with historically few options.
In an accompanying editorial, Drs. Dalen and Govinda highlight both the promise and perils of this approach. They point out that while these results are encouraging, the transplant candidates were a carefully selected subset, and any move toward wider adoption needs multi-center randomized trials, long-term outcomes, and a careful look at organ donor stewardship.
Moving on to the next original investigation, let's turn to timely treatment access, or lack thereof, for patients needing prescription medications. Access to essential medications can hinge on a single insurance decision at the pharmacy counter. Dr. Levy and colleagues used a national pharmacy claims database that tracks what happens when patients try to fill their prescriptions. They looked at more than 2 million first-time outpatient prescriptions for single-source branded drugs between 2018 and 2024. Nearly a third were rejected, either outright or because of prior authorization or step therapy requirements. The rate of these formulary-related rejections grew from 24% to 41% over the study period, with the most denials seen in exchange and Medicaid-managed care plans. More troubling, nearly half, 48%, of patients with initial rejections ended up without any medication in the same therapeutic class within 90 days, often facing a 2-week delay even if they did receive a substitute. So this wasn't just administrative hassle. These denials can mean delayed or missed treatment for patients with serious medical conditions.
And Preeti, while we're on the topic of access to medication, let's turn our attention to GLP-1 receptor agonists and the ease with which patients can get versions of these medications online. Ashwin Chetty and colleagues conducted a secret shopper study of 49 websites prescribing GLP-1 drugs online. They found that 45 sites wrote a prescription, sometimes in less than 5 minutes, and with more than 2/3 of these sites, the medications arrived by mail rapidly and often with minimal clinical oversight. All sites required only a questionnaire, with less than 30% requiring a video or phone visit. 20% shipped drugs just after a brief photo upload, sometimes even despite missing requested documentation. Most of these prescriptions were for compounded, non-FDA approved versions with little attempt to verify prior use or to coordinate care. The study clearly demonstrates that patients can now order GLP-1s with a few clicks and almost no engagement from a prescribing clinician. That ease comes at the risk of overprescribing, concerns about drug quality, and the lack of attention to comorbid medical conditions.
Well, Linda, this is fascinating and timely, and a reminder that access and safety don't always go hand in hand. As the market for GLP-1s explodes, these issues are only going to grow. As noted, there's a risk for overprescribing and the missed opportunities to manage comorbidities. So this is something both clinicians and patients really need to pay attention to. All right, moving on, we have another new research letter. This one shares some national data on deaths caused by law enforcement in the United States. This general topic remains an urgent public health issue, and during recent years, we've seen more reporting on this issue and, unfortunately, more deaths. Dr. Raymond King and colleagues examined national mortality data covering the time period between 2003 to 2024 in the United States. They found that annual deaths among adults rose from 363 to 809, and deaths among children increased from 8 to 37, both increases representing approximately a doubling in annual rates. Nearly all deaths were among males, 95%, and non-Hispanic Black males had the highest mortality rate each year, including among adolescents. More than 87% of these deaths involved firearms. These increases persisted even as national conversations and scrutiny have intensified. The persistently high and rising rates of deaths caused by law enforcement highlight the need for ongoing surveillance and interventions to help reduce deaths, particularly efforts to prevent firearm-associated deaths.
Now let's take a look at this week's opinion articles. Dr. Cohane explores a new opportunity for artificial intelligence in health administration in a JAMA Viewpoint article. He argues that instead of just automating coverage denials, AI can help expose hidden inconsistencies in payer and clinician decisions, making disagreement itself a diagnostic signal. When both sides use AI for adjudication and logging, mismatched interpretation of contracts and clinical facts can be systematically audited and ideally fixed upstream.
We have another viewpoint by Dr. Linden and co-authors that examines how the availability of Alzheimer disease biomarkers affects end-of-life decision-making. With knowledge that Alzheimer pathology is likely present comes the psychological pressure of a countdown clock. Many patients worry about losing decisional autonomy with significant psychosocial implications. Clinicians are receiving increased inquiries about physician-assisted death by patients seeking or who have recently received biomarker confirmation. The authors call on clinicians to address the fears and social pressures that can drive these requests, emphasizing the need for careful counseling, follow-up, and robust dementia-related support to ensure true autonomy is preserved for patients seeking biomarker testing.
We also have a new editorial by JAMA Plus Trials Editor-in-Chief Dr. Allison Huang and JAMA Health Forum Editor-in-Chief Dr. Sandro Galea. In their editorial, they take on the long-standing disconnect between how clinical trialists and policymakers view evidence. They point out that trials focused on health policy often run on different timelines, ask different questions, and encounter unique obstacles around so-called equipoise, and measure broader impacts like equity and cost. Their takeaway, bridging this gap requires new designs, pragmatic outcomes, and better planning for real-world applications, and clinicians should recognize these constraints when interpreting policy-focused trials.
Let's close with some pearls for clinicians and patients.
Can you discuss recent trends in the U.S. in terms of heavy drinking, which I think you defined as 5 or more drinks on any day, or 15 more drinks per week for men, or 4 or more drinks on any day, or 8 or more drinks per week for women?
Yeah, so we've seen actually in the United States that the prevalence of alcohol-related liver disease has risen. And what we saw particular a trend during COVID, where we saw a lot of increase in the United States and also in Europe. However, the rise in the United States seems to be more pronounced, where in Europe it's stable high. And that's associated with that this is the leading cause of liver disease, with In the United States, it's 43% of all adult liver transplantation. That's 3,500 a year that's done by ALD. And still the majority of these people, they never get to a transplant. And the pattern is the same in Europe.
You just heard a short clip from this week's JAMA Clinical Reviews podcast on alcohol-related liver disease with Dr. Craig. Dr. Craig and colleagues authored an informative new review on alcohol-related liver disease, which was published earlier this week. Alcohol-related liver disease is now the leading cause of liver-related death and the need for liver transplantation in the U.S. and Europe. In their review, Dr. Craig and colleagues underscore several new and persistent clinical realities for 2026. First, alcohol-related liver disease can develop with about 20 grams of alcohol a day in women or 30 grams in men, which is roughly between 1 and 2 drinks per day. Most patients have no symptoms until advanced disease or clinical decompensation, so systematic, non-invasive fibrosis testing is important. Even small reductions in drinking can cut the risk of decompensation and death. Full abstinence is ideal, but support and medications can help in moderate cases. Behavioral therapies and in select patients, medication-assisted treatment to promote alcohol cessation are recommended approaches. And finally, early, accurate diagnosis and assessment for liver transplantation should be considered for severe hepatitis or decompensated cirrhosis. I also want to highlight the authors include several great summary figures on pathology, natural history, diagnostic pathways, and management. These are worth checking out. Shifting gears for some information directly for patients, the JAMA patient page this week covers hepatitis B in clear, practical terms. It explains what acute and chronic hepatitis B infection are, how it's transmitted, and how vaccination can help prevent thousands of cases and deaths every year. As we wrap up, there's a lot happening in health news. Be sure to tune in to the JAMA Medical News Summary podcast that publishes every Friday. For insight into the latest medical news, you can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
Well, that's a wrap for this week's JAMA Editor's Summary. Thanks, Preeti, and thanks to our listeners for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens, Dr. Michael Lipnick, and the team at the JAMA Network. A link to this JAMA content can be found in this episode's show notes. To follow this and other network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
The script for this podcast was generated with assistance from GPT 4.1 OpenAI tools following an editor-developed prompt. The script was then reviewed, edited, and approved by editorial staff. This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.